Is that better?
Perfect. That's awesome. So it is National Immunization Awareness Month. So it's a perfect month for us to come to give you an update. We really focus on, immunizations around the entire year, but this month in particular, it's one of the months where we celebrate the impact of immunizations. And if you go to the next slide, I guess one of the things that I always think about is, we have not seen smallpox, although we do have monkeypox. It's not smallpox, but smallpox in the United States in quite a long time. And then when we think about polio in the 1950s, I think we were having as many as 15,000 people a year in the US. And that's with the populations in the 50s that were paralyzed by polio, and then some with other kinds of problems related to. So immunizations have actually really impacted us in a positive way, and they are an essential part of our preventive health as individuals in the United States. And children's vaccinations are an important part. And just from a clarity standpoint, to raise awareness, children in Washington State, all 18 and younger, vaccines are provided at no cost for the parent or the child. Immunization, there is an administration fee that's charged at most places where you go, and that's for them to actually do the vaccine. But the cool thing is, if you can't afford to pay for that, most places will actually waive that cost. So, and those are at all Vaccine for Children programs in Washington State. So I'd like to put a plug in for the Vaccine for Children program, because Washington is one of the few states in the US that actually does have that universal vaccination program. So really good that we have that. Next slide. Anytime I talk about vaccines, I always like to make sure that people know that we actually have a lot of work that continues to happen around vaccine safety. And so I know that, whether it's the COVID vaccines or other vaccines, there has been questions, and this is sort of the developmental cycle of a vaccine and the processes that go along with it. And even after a vaccine is actually out and in use in the community and routinely recommended by the Advisory Committee for Immunization Practices, there is still ongoing safety monitoring that occurs. And so to me, the fact that those processes are very public and transparent for people to be able to watch those kind of discussions, to look at the information from, what they're looking at and be able to understand what's happening around vaccine safety is one of those things that makes it be a wonderful kind of component for us as a country, especially given that there are quite a few vaccines that are recommended for children. But we also don't have the incidence of disease. And I just was reading today about a measles outbreak in Zimbabwe that's happening, where there have been 80 children that have died since the 1st of April this year because of measles. And we think of that as being, a minor kind of a less of an issue in the United States. And again, it's because our vaccination rates are higher and there's less spread of disease. Next slide. So this is a little bit more about vaccine safety. There are lots of overlapping systems that actually come into play, and some of them are unique for COVID, like the V-Safe program we've never really had in the past, but many of these programs overlay, and again, it's ongoing monitoring that occurs. Next slide. I like to remind people that the VAERS system is part of our nation's early warning system. And I know that sometimes people will talk about VAERS and go, can you just, there's so many things that are reported to VAERS. And it is because it is a public system and anybody can report. And in fact, it's intended to be visible for people, the same idea of that transparency. So if anyone who has an event that occurs after they're vaccinated, even if it seems like it's unrelated to the vaccine, it gets reported or can be reported into the VAERS system. So that does help us with knowing that if that is looked at the national level and we identify that, oh gosh, there are more of these things happening after someone gets this vaccine, it allows us to be able to do a deeper dive into it, to look at if there is a concern. And when I say we, in this case, I mean the federal government. That system is actually monitored and managed through FDA and CDC. So I'm really proud of all of the vaccine safety work that happens in the integrity in those processes. Next slide. Actually, just 2 slides so I can move along. I think there's a little bit
For
of
some reason is
I started to say it's a little bit of a delay. So we're going to switch and talk a little bit about COVID. And this just gives you the current case rate stuff for COVID in the United States. And I think it's important for us to continue to remember that there are still a lot of COVID cases happening in the US. I heard today on a call our numbers are continuing to drop down a little bit. And I know that we've been now in the pandemic for over 2 years. And I know that there is fatigue in the idea of, the fact that we're continuing to have COVID, and can't I go back to kind of the way things were before? But for those that are not vaccinated, or for those that don't stay up to date, COVID can still have very significant impact. Next slide. I know sometimes I hear parents ask, well, kids don't really get sick because of COVID, so why do I need to worry about it? And I think the thing that you have to remember is that individuals who develop COVID, even if they've been vaccinated, you could develop long COVID, but it does look like there are much higher incidents of long COVID in those who are unvaccinated. And the symptoms appear to be more severe. And so these are a couple of pieces. This actually came from an ACIP meeting, the Advisory Committee on Immunization Practices. And they look at the data to look at comparisons about what happens for those that are vaccinated versus otherwise, but really looking at data across communities of individuals. Next slide. And so the other thing is to remember that you don't actually have to be hospitalized to develop long COVID. We still have quite a few people in the US and quite a few people in Washington State, especially children, that are not vaccinated for COVID. And this is actually from a study in the United Kingdom that gives you information about children. But what they found is that even again, children who are non-hospitalized, so they get sick with COVID, but they aren't even sick enough to be considered to need to be hospitalized, but they get sick enough to have long COVID symptoms. And their symptoms are very similar to those that adults experience. It's just sometimes they're not able to articulate that they're continuing to have fatigue. It just may be that the parent notices it because the child is not as active as they were preconditioned. Next slide. So other things are those who have had COVID. Again, you're less likely to have vaccine breakthrough or to have developed illness or have severe illness if you've been vaccinated. And next slide. Just this shows that those who are revaccinated, again, if you're vaccinated, even if you develop COVID first, like your child has not been vaccinated, develops COVID, getting them vaccinated after means that they'll have less potential or less risk of getting COVID again in the future, because we will continue to see cycles of COVID as we continue to have variants. So we're, almost through this, the BA4-5 that we've seen, BA4 and 5 that we've seen over the course of the last few months. It's about March or early April. And so again, it continues to show that individuals who are vaccinated, as long as they're staying up to date on their vaccination status, it does make a difference with relation to severity of disease, hospitalization, and definitely if they get more disease in the future. Next slide. Okay, this is the same information. I just want to make sure we have enough time to cover everything. Mm-hmm. So this next slide actually shows you a picture of the difference in those that, just advance one slide. It's hard for me to know if it's not advancing or if there it is. Yep, perfect. Yeah. So this shows you the difference in those who are vaccinated versus those who aren't. And you could go, well, in April, it looked like it was the same, right? If someone was vaccinated or if they weren't. And that's just because there weren't as many cases happening. So there's not as much impact in that separation. But in those months where there's a lot of caseload, you can see the clear difference in the number of people who die after COVID or die in association with COVID when they're vaccinated versus unvaccinated. Next slide. So this is our staying up to date information. And so I actually, on this slide deck, this is the recommendations currently for staying up to date. And Chris is going to go into a little bit more detail with this. But this actually shows you kind of the current information. In addition to that, on the CDC website, which is linked on this, you can actually go in and kind of do a test for yourself to see, am I up to date? To make sure that you and your family, so anyone that's 6 months or older, should be vaccinated for COVID. So this will actually give you a link to be able to know, for you to go in and kind of fill in your personal information about whether you're immunocompromised, how old you are, when you were last vaccinated, and your status. Next slide. I'm going to hand off to Chris.
Okay. So this is the COVID vaccination schedule for most people. And it's an interesting graphic. You can see at the side the link to the PDF that has this graphic. And you'll notice different things, like for children aged 6 months to 4 years, it's a 3-dose regimen for the primary series. And you'll see that Moderna and Novavax are 2-dose primary series regimens with that. It talks about booster doses, and booster doses are for Moderna, it's children or people age 18 and older. But for Pfizer, it's people age 5 years and older to get the booster dose. And then you'll see over to the right options for a second booster. And really, second boosters are indicated for people over age 50 or people with immunocompromised, which we will talk about on the next slide. And also just a tricky one with people that did receive the Janssen vaccine, which is a lot less common now. But for people who receive the Janssen vaccine, they're recommended to get vaccine boosters at least 2 months after their first dose. And if for some reason they elected to get a Janssen vaccine for their booster dose instead of an mRNA, which is the preferred, they would get a second booster of mRNA for that. We can go on to the next slide. So the other difference we look at is for individuals with moderate to severe immunocompromise. And you'll notice for most of the cases, this is a 3-dose primary series. The second dose is usually given 3 to 4 weeks after, depending on the vaccine. It's 3 weeks for Pfizer and Novavax. It's 4 weeks for Moderna. And with Janssen, once again, it's for that additional mRNA dose, it would be 4 weeks later. With Pfizer and Moderna, in most cases, there would be a third primary dose. And so Moderna, it's ages 6 months and up. Pfizer, it's age 6 months and up. They would get a third primary dose, and that would complete their primary series. The Novavax series, that I'll talk a little bit more about Novavax in a minute. That is only a 2-dose primary series currently. And then once again, you'll see the idea of a second booster that occurs with individuals ages 18 and older with Moderna, and individuals ages 12 and older with Pfizer. And they are eligible for a second booster 4 months after their first booster. Next slide, please. So pediatric vaccination schedule, just a quick thing to look at, because it's really hard, and we end up double checking every time we go to vaccinate just to make sure we're giving the correct dose and the correct number of doses and at the correct interval. And the CDC recommendations really try to be consistent with this, but with a little deviation from the manufacturers. And so for 6 months to 4 years, if a child is receiving a Pfizer vaccine, it's a 3-dose primary series. Once they hit age 5, it is a 2-dose primary series for most people. And most people means people without moderate to severe immunocompromising conditions. In Moderna, everybody without immunocompromising conditions would have a 2-dose primary series. And once again, you see with immunocompromised for either of them, it's a 3-dose primary series. Next slide, please. So looking at the side effects for children, in general, the little kids don't get as many side effects as teens and adults. And the ones that we see most commonly for kids ages 4 years and older is injection site pain. There might be some redness or swelling, fever, tiredness, headache, chills, body aches, and swollen lymph nodes. That's a little bit more common. For kids up to age 3, it's more injection site pain. Here's where you may see more swollen lymph nodes. They may be more fussy. They may be sleepy, and they may have a decreased appetite. Next slide. So on to Novavax. And this was recently authorized for use. And we've noticed, I think there have been over 7,000 doses delivered in the United States so far, because it's really relatively newly authorized. And it's a little bit different. It's different from the mRNA vaccines and different from the Janssen vaccine, which is a viral vector. And it's a protein subunit vaccine with an adjuvant. So the protein subunit is the spike protein that exists on the COVID-19 virus. And then the adjuvant is there. It's an ingredient that they add to it to improve the immune response to it. It's been very effective. It's been used for years. We first saw it used with the hepatitis B vaccine a few decades ago. It's used for hepatitis, well, hepatitis B, for pertussis, HPV, and other vaccines. So it's really a tried and true technology. The interesting thing about this is in their phase three trials, it was over 90% effective against moderate, mild, moderate, and severe disease. And in fact, during their trials of the intervention group, or the people who received the actual Novavax vaccine, they didn't have anybody who developed moderate or severe disease with that. Now, just keep in mind when we talk about that was really before the onset of Omicron. And so this is shown to be very effective against earlier variants, including the Alpha variant. So study is ongoing to see how this Nova vaccine responds to the later variants, but still will offer protection just like the other vaccines do. Next slide, please. So the vaccination schedule, just like we talked before, it's a 2-dose primary series given 3 to 8 weeks apart. Now, what I didn't mention earlier is how do you choose 3 to 8 weeks apart for most people? And really, there are times that people may want to delay that second shot of the primary series to closer to 8 weeks. Like if you have an 18-year-old young man who would be at greater risk of myocarditis, he can reduce his risk by delaying it instead of getting it at the 3-week mark. For people with immunocompromising conditions, though, we want to get that protection loaded a little earlier. And so you'll notice with the schedule, if they just want people with immunocompromising conditions to have that in 3 weeks. The other thing I'll mention, though, about delaying it is there is some study that suggests that delaying it a little bit more does help to improve the immune response in some people. Next slide, please. So this slide just talks about myocarditis risk, and it's very interesting. You'll notice that it talks about myocarditis associated with mRNA COVID-19 vaccination, but really the data is very similar with the Novavax vaccine as well. There is an increased incidence of myocarditis after vaccination with Novavax, consistent with what you see with mRNA vaccines compared to if you looked at the general population, like if you looked in 2019 before the pandemic occurred, what is the incidence? And we'll talk about that in a sec. And you'll see that if people develop viral myocarditis, so if they get the COVID-19 infection or a viral infection that causes this, you will see that almost half of them end up needing ICU care, and 30 to 60% of them have a viral course, but don't have any symptoms with it. Yes, it's still more common in males. The onset is usually later than if one gets the vaccine. But just looking at this overall, your risk of serious problems related to myocarditis or the incidence of myocarditis is much higher with getting a COVID-19 infection as opposed to vaccination. Next slide, please. So this is a slide I like because it really does put it in perspective. So in 2019, the average rate of myocarditis was about 1.3 per 100,000. If a person was hospitalized with COVID-19, the risk was about 226 per 100,000 people, so a significant change related to the infection. If you got the COVID-19 mRNA vaccine, the incidence, the risk of it went up from 1.3 to 2 per 100,000. And so if you look at this, you realize that you're 3.5 more times likely to be struck by lightning than you are to get myocarditis after a COVID-19 vaccination. And really, honestly, assessment of risk, this is what we do with everything, is we determine what risks we're comfortable with and what risks we are not comfortable with. And this is just another indication that vaccination is definitely a safer choice compared to not vaccinating. Next slide, please. And finally, I just want to bring this up because as you consider vaccination for yourselves and for your family, whoops,
Sorry.
that's all right. just keep in mind the professional organizations that support this. There's been so much research that has gone on with COVID-19 infection and with all of the vaccines and all. And we have these highly respected organizations that really support vaccination against COVID-19 and to reduce serious illness and death, and really to some extent reduce transmission. So as you look at these organizations, you probably recognize some that you respect their members and what they have to say. And before I pass to Kathy, I just want to throw in a blurb about Test to Treat, because that's just well, it's a federal program, but in Washington State, we have it there. I'll put in the chat the website that you can go to, so that if you were to have a positive COVID test and could not get into your primary provider or get into a provider, you can actually go onto this website or call, and I'll put the phone number on there, and get in contact with a healthcare provider that can help explain to you the potential treatment options for you that you may be eligible to take, and help you with getting that ordered for you so that you can go to a pharmacy and get this done. So I will put that in the chat for you later. And now I'll pass it on to Kathy.
Thank you.
Thank you. Next slide. I'm going to go really quickly and give a little bit of information about monkeypox. So next slide. So there have been cases of monkeypox. So monkeypox is a virus that more severe than chickenpox, and I'll give you a little bit more detail on it in just a second. But it is a virus that actually is endemic. It's found in some countries of the world. But since early April, I believe, is when the cases started, March or April, around the world, we actually had began seeing cases in countries where we don't typically see cases of monkeypox. And so as of the 12th, which is the date of the last posted information, globally, there are over 31,000 cases around the world in countries that have not previously reported monkeypox virus activities. And in the United States, we had over 11,000 cases. And in Washington State, we had 265. So really small numbers if you think about how many millions of people have been vaccinated against COVID. And the risk to the general public right now is still very low to develop monkeypox, but there are some individuals who are a little bit higher risk based on communities where they might spend time, or individuals that they might spend time with. And so really important to know, again, process-wise, what's, what you can do to protect yourself. So next slide. So it is an infection that is caused, it causes a rash and other symptoms, including things like a fever, sometimes lymphedema or elevated or enlarged lymph nodes in the arm and in the groin area. Again, it's not very common in the United States, but it can spread person to person with any type of close contact, skin to skin. Regardless of sexual orientation or gender or identity. And it can spread to children. And in fact, there have been some cases in the US in children, and some cases in Washington State now in older children. It can also spread between animals and from animals to people. And now also we know that it does spread from people to animals. There have been some documented cases where individuals who have been caring for their pets, when they have monkeypox, actually their pets develop the MPV virus and show symptoms. Direct contact with the skin or the body fluid of the infected person, including sexual contact, that's where the contact occurs. And when you have open skin or open mucous membranes, that's where you actually are exposed. It can also happen through the virus contaminated objects such as bedding or clothing. And so going to maybe a fitness center where someone has worked out and they have a towel laying down or a washcloth laying down, and you touch that, if it's been a close period of time since that, you actually can develop monkeypox from that exposure. So just making sure that you're doing things to protect yourself and not touching objects that are contaminated. And then respiratory droplets. So we think of chickenpox as being spread, and in fact, it is pretty infectious and from a respiratory standpoint. So you can be in the room with those droplets of someone, they're coughing or sneezing, on you, you can actually develop chickenpox. Well, with the MPV or monkeypox, it takes a lot more direct contact, and it would be sort of like face-to-face prolonged contact. Also, the sort of the wounds that you develop as part of the rash. Next slide. The wounds that you develop as part of the rash, when you start, those wounds will, as you can see in these pictures, they'll usually become, pus-filled or fluid-filled. The bumps sort of become fluid-filled, and the wounds will scab over, just like they do with chickenpox. But the problem is, again, those scabs, as well as the secretions or the drainage from the monkeypox wounds, can actually, again, spread the virus. And you are contagious until all of the wounds have completely healed. And again, those scabs that are on the wounds are also contagious. These are the initial symptoms and things to be aware of. Next slide. So what to do? So the key pieces of what to do is, if you've had contact with a person who has a confirmed or probable case, you need to talk to your healthcare provider or to your local health jurisdiction. So you should definitely isolate yourself from other persons in a single room or a single location until you can be evaluated. There are options for treatment. Next slide. There is treatment options. Most people recover without any treatment, but if you have not developed symptoms and you've been exposed, then you can be vaccinated. And if the vaccination is done within the first 4 days after exposure, it actually can reduce or prevent symptoms. If it's after that 4 days, within a 2-week period, and you still don't have any symptoms, it can potentially reduce your symptom severity, how long you keep the disease and the severity of your symptoms. If it's been after that, or for some reason you can't be vaccinated, you have allergies to eggs or other things, then there are some treatments. There's an antiviral treatment that can help reduce the severity of the disease. Next slide. This is just the piece of information of where to go. There's a lot of information on the Department of Health website. There is our helpline that's available with assistance in 240 languages through this number. They can actually help answer questions for you. There's a lot of information on the CDC website. And the key piece around the MPV or the monkeypox is just making sure that you're doing what you need to do to protect yourself. And currently, we're vaccinating only those who have either been exposed or who have other risk factors. So check with your local health jurisdiction or through your healthcare provider, really, to find out if you're one of the individuals who should be vaccinated. Again, we're currently seeing it in mostly the community of individuals who are men who have sex with men, but it is not a sexually transmitted disease. It is actually, or an infection, it is actually a virus similar to chickenpox, but again, the wounds are a little bit deeper, are more severe, and I understand they are very painful. Next slide. I'm going to take us back to the end, and just, it's also the beginning, and say it is National Immunization Awareness Month. So we really like to focus on importance of people being immunized. And so whether it's monkeypox or COVID, or we talked about measles, we talked about polio, we talked about smallpox a little bit at the very beginning. Those are all diseases that, again, there are vaccines for them. And so we really want to continue to ensure that individuals are protected, both for themselves, but also for the people that they spend time around, be that family or friends, or work employee, schoolmates, other people. So with that, I think we're finished. If there are questions, or I know we went over on time, and my apologies for that. So.
Okay.